Other venereal diseases have also reached near epidemic proportions. They were responsible for the deaths of more than 7,000 people in the United States in 1987. Lee Hochberg of public station KCTS Seattle reports.
It's Wednesday night swimming class for these 4-year-olds, and it's hard to tell who's getting the biggest kick out of the class, the kids or instructor Jody Bartee.
Do you do swimming like this?
Jody's a swimming instructor with the Seattle Parks Department and an actress when she can find a part in Seattle's theaters. She's 37 years old, recently married for the first time. Her exuberance is authentic, but it also helps to mask a painful personal secret. Jody Bartee has 2 sexually transmitted diseases. She has herpes, an increasingly common disease known for genital sores and for which there's no cure. And she's been infected by a papillomavirus, a sexually transmitted disease that's so far been asymptomatic, but scientists now strongly believe could precede cervical cancer. Jody is one of 13 million people in this country who are fighting sexually transmitted diseases, or STDs for short. There are 50 different kinds of them spreading through American society, many of them at an epidemic rate. The victims are rich and poor, sexually active and even not so sexually active, maybe the swimming teacher at the local pool.
Oral sex, it's still the same. There's a possibility of transmission if she were in the active phase and if there was a direct contact.
The Sexually Transmitted Disease National Hotline in Palo Alto, California. Staffed by volunteers, this nonprofit toll-free information service receives some 80,000 calls a year from across the United States, from people worried that they have contracted an STD.
Penicillin is the drug of choice for that, but it is curable.
We're answering more calls than ever before. People are worried about what they may have done in the past. Some of our callers have somewhat changed their tune a little bit, and they've modified their behavior. Some of them have. But even then, they're still concerned about what they did 5 years ago.
Director Michael Adele says some STDs lie dormant for years after infection before flaring up. He says half the calls these volunteers get are about herpes. But with other diseases now burgeoning out of control, the callers are asking about the whole range of STDs. The Centers for Disease Control says the most common sexually transmitted disease is chlamydia, a urinary tract infection. 4 million cases are reported per year. They're treatable with antibiotics. Gonorrhea is next, with 1.6 million cases expected. Some are treatable with antibiotics, some aren't. Papillomaviruses will be reported 1 million times. They can require surgery. Genital herpes will occur up to 500,000 times. It's uncurable. And syphilis, with 100,000 cases expected, is treatable with antibiotics.
We really live in an undeveloped country when it comes to STD control. What's happened is we have epidemic syphilis, epidemic resistant gonorrhea, epidemic papillomavirus infections, herpes, which we would call hyperendemic because such a high proportion of people have it.
Experts, like the University of Washington's chairman of medicine, Dr. King Holmes, say 2 epidemics are occurring simultaneously: a surge of uncurable viral STDs, like herpes, and an epidemic of bacterial STDs, like syphilis and gonorrhea.
The number of cases of penicillin-resistant gonorrhea has gone up, has just skyrocketed.
Pervasive use of the cocaine derivative crack in minority populations is compounding the problem.
This is the best one. This is the best with the rest.
In crack houses like this, crack smokers often engage in periods of heightened sexual activity with many partners. Whatever diseases they have, they give to their partners. And many women engage in sex with the drug dealer as payment for the drug. Disease spread has become so prevalent that even some of those dealers have grown wary.
I can't see jumping in bed with a broad that I know that's been out there for a crack. Because if she do something with me for a crack, how many other dudes she be doing something with? And then all this AIDS and herpes.
Prostitutes, like this woman, say they see street STDs making their way into mainstream society when their customers refuse to wear condoms to protect themselves.
It's the guys who don't want you to use one.
The guys don't want you to use
No,
condoms.
the guys are the ones. They want flesh on flesh. They will pay you more not to use protection. Absolutely. Absolutely, to get the real deal. Yes. You can double your money if you won't do that.
Meanwhile, in middle-class America, viral STDs like the papillomavirus, which could cause cancer, have become the predominant type seen in clinics.
They clearly are epidemic. A rough figure would be that maybe a quarter of adult women who've been sexually active are carrying this virus.
Back from her swim class, Jody Bartee settles down for an evening with her new husband, Larry. Like thousands of American couples, Jody and Larry are getting accustomed to their shared health problems, herpes and the lesser-known but more common papillomavirus.
Had you even heard of this type of virus?
Never heard of it. I'd heard of herpes, I've heard of syphilis, gonorrhea, and all the biggies, but I'd never heard of venereal warts, you know.
Do you have any idea where you got it?
Mm-hmm. Ball's in his court now.
No, I don't. Prior to meeting Jody and at the end of my first marriage, which was 9 years ago, I was extremely active sexually. And rather blasé about any type of diseases. I didn't know I had it. I had no idea that as a matter of fact, it's still never shown up.
Becoming part of a national epidemic has been difficult for the couple.
I went through a period where I blamed myself terribly and felt like dog meat. And I don't know, Jody's never told me whether or
I
not...
felt like used goods, even though I knew he cared about me. I think that's probably a real normal reaction. You don't have to be a slug or you don't have to be a slime in order to get it.
It could happen to June Cleaver on Leave It to Beaver.
The couple's misfortune is hardly unique. According to the Centers for Disease Control, just as 1 out of every 5 American adults has the papillomavirus, 1 out of every 4 American adults has herpes. Startling statistics. But science has hit a roadblock in its attempts to combat them: money. In San Francisco, for example, researchers at the Genentech company are close to developing the first vaccine to protect against herpes. But Senior Vice President Dr. David Martin says Genentech is shelving its studies of the vaccine and will not market the product.
The problem is that the incentive for the corporation is simply not there to develop and market vaccines.
Simply put, Genentech fears that if the vaccine has any side effects or fails at any time to prevent the disease, an American jury will hit the company with a huge damage lawsuit.
We obviously have to protect ourselves from that, or our industry or our company will go down the tubes.
Martin says that liability issue probably will keep the herpes vaccine, which could be ready for human use in 2 years, from actually being marketed in this country for another 10 years. And as biotech firms fight the liability issue, university scientists are fighting a political issue. Money for research has been shifted to study another STD, AIDS. This year, for example, the government plans to spend $1.2 billion studying the AIDS virus, and only 1/10 of that amount studying all of the other STDs combined. Dr. Lawrence Corey heads one of the nation's top herpes research teams at Seattle's Children's Hospital.
There's no question that there has been a drain in personnel in the number of active people who were working in genital herpes who have moved over to the HIV field. The effective number of dollars is decreasing, and actually my team in herpes is actually getting smaller, whereas the team in AIDS is getting a lot larger.
The cutback comes at an inopportune time. Corey's team was developing a test to detect the presence of herpes lesions in the female birth canal. They cause 1,000 cases of devastating newborn herpes each year. Robert Oftenkamp of Seattle is one of those tragic 1,000 cases. Now 3 years old, he was born brain damaged when his mother, Jackie, had a herpes flare-up during labor, and he was exposed to the herpes virus.
He has seizures. He doesn't crawl. He doesn't roll over. He has a very hard time with his respiratory system because his muscles are not developing the way that they should. so he has a real hard time as far as clearing any junk that he gets down there. He doesn't talk. He makes a lot of sound, but he doesn't talk.
He's a great kid. You know, I don't regret any of it, actually. And, of course, he's the only one I have had, so we don't know any different.
Jackie hadn't known she had herpes. The test Dr. Corey's staff was working on might have detected the active lesion in the birth canal, so a child like Robert might have been delivered healthy by cesarean section.
It's not right. There's a lot of stress, of course, right now on the AIDS. But I don't think the rest should be abandoned either.
In an ironic twist, taking money from STD research actually may lead to more cases of AIDS. New studies find that when people contract some STDs, their risk of also contracting AIDS increases. The University of Washington reports that gay males with the open sores of herpes and syphilis have an increased risk factor for the acquisition of AIDS. And earlier reports show people with chlamydia are more susceptible to AIDS. Holmes says the policy to rob STD funds to pay for AIDS research was short-sighted at best.
It's very clear that what initially happened was disastrous as far as STD control is concerned. Then it becomes clear again we've got to reinvest into control of these other sexually transmitted diseases and research on how we're going to do a better job than we've done in the past in controlling them.
Use condoms or jails or just say
In the absence of new research dollars to help treat STDs, Holmes says it will fall to public education messages like this one to help prevent STDs in the first place, and to spread word that while they don't get as much press, their consequences could be as dire as the AIDS virus.
if you're gonna have sex, avoid that problem. Listen, homeboy, just use a condom. Just